Welcome to Healthline 3. I'm Terri Simmons. Today we're talking with Dr. Jim Burke and Dr. Kamel Brakta of Willis Knighton Advanced Laparoscopic and Robotic Surgery about intra-abdominal and robotic-assisted surgery. We'll be taking your calls throughout the show, and as a reminder, please make sure you're in a quiet room with your TV turned down low so we can be sure and hear your questions. The number to call is 318-219-4569, and you'll see it at the bottom of your screen throughout the show. So thanks so much for joining us, doctors. We appreciate it.
Thank you for having us.
So let's start out, first of all, it's such a pleasure having you, and let's start out with, for anyone watching who doesn't know, just describe exactly what robotic surgery is.
Sure. So robotic surgery is essentially an extension of laparoscopic surgery, which is performed through a minimally invasive way. And the robot itself is a mere tool which gives us fine instruments that really help us get the job done with less trauma to the tissues, less bleeding, less scarring, which all ultimately translate to less pain for the patient, and the patient being able to get back to normal daily activity and be able to get back to a normal routine faster than would otherwise be, as compared to the old days when surgeries were performed through bigger incisions through the abdomen, for example.
Okay, and so set us up for what it looks like actually in the operating room, because the robot is doing it, but you're controlling everything. How far away are you from the robot? How does this work?
Right. So the robot itself is basically a three-piece instrument. You have the actual robot with the arms, which is what attaches to the patient, and then you have a cart with all the monitors and the equipment, and then there's a console where the surgeon sits, which is in the same room except in the corner. Once the patient is ready for surgery, the robot is brought in, the arms are attached to the patient through small little ports which are approximately 1 centimeter. Once those ports are placed in the abdomen through the skin, then the robot is docked to those ports, and the arms have instruments that go through them into the ports with a three-dimensional camera, high-resolution camera, which enables us, which is actually magnified 10 times what the human eye can see, thereby dramatically increasing the resolution of what you're looking at, which again enables you to be very precise, very accurate, thereby causing minimal trauma to the tissues, which is really important for patient recovery.
That's incredible. And so we're talking about abdominal surgery. So give us some example, anyone watching, what types of surgeries you do with these.
Well, you can go out, as Dr. Brakta said, you sit at the controls or the booth where you sit and you guide the instruments that are on the end of the robotic arms. There are a multitude of different operations. There are operations for hernias, gallbladders. You can take out colons, operations on the stomach, and they're very complex procedures, and you can do that because of the high definition three-dimensional cameras that we use. And instead of having the big incisions, you have very small incisions, and instead of staying in the hospital, it used to be say 5 days to a week to have your gallbladder out, and you now go home the same day with that. Other operations for colons and other more complex things, instead of a week in the hospital, you're maybe an overnight stay or just a day or two. So it, as he said, it decreases the tissue damage, which equates into less pain, which is a shorter hospital stay and less time off of work.
And so let's talk about the benefits too. So those are just something to really talk about, that shorter hospital stays, less pain, quicker recovery. Is that all because of the small incision and the precision that you can do rather than open surgery when you had to actually open the patient up?
Correct, which is a really very important distinction when you're comparing robotic surgery versus open surgery, for example. We all know that, when you hear that somebody's undergoing surgery, especially traditionally, we think about open, long, big incisions causing bigger scars, and patients usually, it takes usually a long time for patients to recover. Nowadays, these procedures are done in such a less invasive way that patients are up and about within 2 days. They certainly go home the same day, and then usually the pain within 2 to 3 days is completely gone, and those patients are back to normal daily activity, back to their jobs, within a few days. So it's important to underscore the concept of why robotic surgery has helped us dramatically improve quality of patients, because now even those patients who may have hesitation about getting something done, especially hernias. Hernias are very common. These are essentially defects in the abdominal wall where you may notice a bulge, whether it's through the groin or through anywhere in the abdomen or in the belly, so to speak. And patients are usually hesitant to get surgery because they tend to think of surgery as a very invasive, big ordeal to undergo. But with the robot nowadays, it enables us to do these procedures in a much safer way and a less invasive method that patients are really not taking that much time off. They're not experiencing as much pain as would otherwise be traditionally, and are back to normal routine within a few days.
And so in what ways is it safer?
So it is safer because you have a three-dimensional camera. It enables you to see with a very high degree of precision and accuracy. So all of that translates to less risk in terms of causing any unintended damage or injury to any part of to any other tissues that you're not intending to. It's also causing less trauma to the tissue because you're being able to be very precise, which decreases the risk of traditional risks such as bleeding, infection, those kind of things.
And does it also give you easier access to difficult places to reach where you normally wouldn't be able to do that?
Correct, and that's a very important part. Especially certain parts of the abdominal cavity that are very hard to reach, even under open procedures. The robot has the capacity to reach those places without causing a lot of damage to the tissues, which is obviously a benefit to the patient.
Yeah, very much so.
Yeah, and it's been a continuum of going from open surgery to more minimally invasive surgery, first with the laparoscope, then transitioning into the robot. And both Dr. Brakta and myself have had advanced training in the robot, which it does take some training and has a little bit longer learning curve to get that done.
Right,
But
so we've had laparoscopic surgery we had too, and now now with the robotics, because I know that was
correct.
something.
It's a slow progression, and we're kind of excited to see how far it's going to go from here with the robot. Everything is, the optics are so good, as Dr. Brakta was saying, that you can see so much better than you can even with the laparoscope now with the 3D dimensional cameras that they have. It's incredible, the optics. And it used to be with the laparoscope you had a drag on the instruments trying to move it, so it was a little bit difficult to move the 2 to 3 millimeters or very short distances that you needed to. And now with the robot it takes all that drag out, so the precision is much more precise.
That's really incredible even to think about, that it's there. The visual must really just astound you, being you doing what you do and seeing this, and now to have that precision where the camera is right there and
Correct.
Seeing precisely what you're doing and pinpoint really what you need to do.
Correct.
Yeah.
It really does. It also enables you to see smaller structures such as nerves, vessels, and be able to avoid them. Hence why the precision is an important concept of getting these procedures done with less trauma to the tissue.
Okay. And is anyone not eligible for this? Do you do this now on everybody who comes in for something like this?
Most patients are eligible for the minimally invasive surgery. There are sometimes, if you've had multiple abdominal operations, it may or may not be a candidate for that, but just about everyone is with that.
And I would think I'm sorry, were you going to say something?
And
No, go ahead.
well, and some people who are even have a bigger body size with that, it's much easier to do it with robotic than to do it open with that.
Okay.
So yeah, pretty much any patient that is undergoing an elective procedure can qualify for robotic surgery. Even those who have had prior procedures in the past or prior open abdominal surgeries, they can still be a candidate. Of course, they have an increased risk of having to convert to an open procedure as compared to someone who has never had surgery, but they can still be a candidate. The other exception is probably patients who have trauma or who are severely ill. But again, those contraindications are relative. So.
Okay. Is there the most important thing you'd like us to know about robotic surgery if someone is just considering finding out more about it?
So one of the common misconceptions, or I tend to get this question a lot from some of my patients, is it the robot that's performing the surgery, or is it you? And I just want to assure, to all the patients or any potential patient out there that the robot is not doing anything that I don't actually, command it to do, so to speak. So the surgeon is still in full control of operating on that patient. The robot is just a mere instrumentation that helps us get the job done much better than laparoscopy or traditional open surgery.
I'm so glad you brought that up, because yes, it is the term. Sometimes people have little, just misgivings about it or misunderstandings, and then that's it. They're like, I don't want a robot. It's not the robot.
Yeah, the robot
still the doctor.
We said, is just another tool.
Yeah, another tool.
That we use like a scalpel or a hemostat or a paraforceps.
Exactly.
And we're sitting at the console and we're guiding those instruments. Those instruments have no independent motion without one of us sitting there guiding them. And because the end of the instruments are wristed, or they can turn 360 degrees, you can get much better angles to operate, and which makes it easier to get into these hard areas that we couldn't before, and makes it much safer for the patient.
Exactly. It's just another tool like a scalpel or anything else you would be using.
Correct.
Yeah.
Exactly.
And you talked about where this can go. Do you see this? You must be very excited when you get in there and you see how well it works for you. What else you could be able to do in the future?
True.
Yeah.
It's as they progress with better optics, better instrumentation, we'll just be able to do more and more, and then we'll get to the point. It's kind of exciting to see how far it will go.
Pretty incredible. Yeah. And also, I would think so. It's faster. You said, right? It's less time. The operation is.
So depending on where you are on the learning curve, certainly initially as you go through the learning curve, these operations may take a little bit longer than traditional open operations. However, once you've gone through the entire learning curve and you're comfortable with the technology, then these procedures can be faster than actually open procedures.
And definitely
certainly.
The recovery is faster than
Correct.
having open
and of course,
surgery.
The benefits that we have outlined are certainly no-brainer when it comes to choosing, should I get robotic surgery or should I get open surgery, especially when it comes to some of these hernias, which are done both ways, open or robotic. I think robotic surgery offers a lot more benefits than open surgery.
And is it up to the patient to decide this, or?
Correct.
Okay.
Up to the patient and their provider, their physician, of course.
Right. Okay, and do you still do as many open surgeries also, or you specialize more in the laparoscopic?
Pretty
robotic?
Much majority is with the robot at this point.
Yeah.
We do very few open operations that we used to do, because we can all do them robotically now, and the benefits are just too great for the patient.
They've got to be, yeah.
And we also have the robotic teams in the operating room who are used to bringing the robot in, docking the robot, and so all the time from the initial learning curve has come way down, so it's almost faster at this point.
And that's
once you have a
thing
designated team for that operative room and for the robot, it makes a lot of difference.
That's what I was going to ask you, especially for your specialty and where you are. These teams that are there with you are specifically trained for this, and so they know how to take the best care of the patient throughout the whole thing. It's a big team thing. It's really specialized.
Yes, it's a lot of effort by not only the team but the hospital. The hospital has to make a significant investment in this equipment because the equipment's very expensive. And I think we have 8 robots at this point?
Correct, 8.
And luckily the Willis Knighton system has been very good to us and spared no expense, so to speak, to get us the state-of-the-art technology which brings all this state-of-the-art 21st century medicine to this region. So
well,
we're lucky that we have that.
We appreciate that, being here. And so no longer does someone have to travel far away to get this care.
They can have it here.
Yeah, okay.
Correct.
Well, we have a caller now. Charles, what would you like to ask the doctors?
Yes, I was wondering on the robotic hernia repair, do you still use the mesh to repair the hernia?
What's your name again, if I may ask?
Charles.
Charles?
Yeah. Thank you for your call. Depending on the type of a hernia, some hernias, depending on the type of the hernia, depending on the size of the hernia, some hernias require mesh, some don't. Depending on where the hernia is, will also dictate whether the mesh is needed. Does that answer your question?
Okay, thank you very much.
And
Yes, sir.
sure.
All right, thank you, Charles. Thank you for calling. That was a good, quick answer to that
Yeah,
question.
that
Thank
was.
you. And so, go ahead.
Just to add on to that, there's also different types of meshes. The reason, because there are a lot of patients who are a little bit apprehensive about mesh use, and certainly meshes in the old days, the synthetic meshes come in a lot of different types, and some were not very conducive to patients' tissues and have caused problems in the past. And you may see those patients may see those commercials, that tell you that mesh is bad for you, and if you've had mesh, contact this number or that number. But meshes nowadays are pretty safe. Of course, no mesh comes with zero risk, but the risks are significantly low because the meshes are designed in a way nowadays that are a lot more conducive to patients' tissues and cause less problems than they used to. So.
Okay. Well, that's really interesting. Thank you so much for answering that question, Charles, because that's something that, we haven't heard about and been able to talk about. So what about, would you like to talk a little bit about bariatric surgery?
So the robot can also be used for weight loss procedures of any type, or stomach surgery, or acid reflux surgery, or any of those type procedures. And in those, actually, the robot is extremely beneficial. When we talk about acid reflux, for example, or hernias that are, they're called hiatal hernias, which are stomach herniating into the chest, the robot is extremely beneficial because it's an area of the body that is very hard to reach with open surgery, but being able to do it robotically gives you an incredible view and also enables you to do the procedure with significantly less trauma as compared to open procedure. So those procedures nowadays are extremely highly recommended to be done with a robot.
Okay. And there's more than one type of bariatric surgery, right?
Correct. There are many bariatric procedures as well that can be done with a robot.
Okay. And do you want to talk about those types of surgeries, or?
Yeah, we can certainly, talk about those procedures probably in another session in the future.
But it is beneficial to have the robotic.
Yes,
okay.
absolutely.
Yes.
All right, and tell us about the pictures that you see. What you see with the robot, the 3D pictures. What is it?
So the three-dimensional view enables you to obviously see three-dimensionally and distinguish the proximity of certain tissues as compared to others within that same view. And in addition to that, the camera is magnified, 10 times what the human eye can see, which is, very helpful for the surgeon because you're able to distinguish structures that may look alike or structures that are not as big, and you can have a higher risk of being injured. So with the robot, that really mitigates that risk significantly, enabling you to get the job done with extremely low risk to the patient, which is really what you want.
And what are some things that if someone came in and they were really just didn't understand this at all, what is there like a definite clear list of benefits and ways that you would talk someone through there? What information would they need to bring you as far as what they're going through, their symptoms?
Well, they would need to just come and we would talk to them and question them and see what kind of problems they were having with reflux, indigestion, other hernias or abdominal pain, and then slowly work through it and get a diagnosis, and then discuss the options of how you can repair it or how you would adjust that or attack that one problem in order to alleviate it if it ends up being a surgical problem.
Okay. And do you have customers or clients or patients who have come in with repeat surgeries where they've had this once and then they have another problem, they come in and have it again? Is that an issue?
Sometimes that will occur. Some people may have had hernias for many years and have it repaired, and through the years it becomes weaker again. But that's a very low percentage of people who end up coming back with that.
Okay. Okay, I think we have another caller for you.
Sure.
Bill, thank you for calling. What's your question for the doctors?
All right, I was watching Channel 3 World News day before yesterday, and they were talking about high blood pressure and COVID-19 being bad.
Okay. Do you have a question about abdominal surgery?
No, high blood pressure and COVID-19 together.
Okay.
He had bad news, but they cut him off before he told us what it was.
Well, the difference between the high blood pressure and COVID-19, anyone with high blood pressure can predispose you to strokes, other cardiac disease, and other illnesses that is associated with. But that's more of a medicine problem that the internal medicine doctors would take care of instead of a surgical problem, which we would take care of.
All right. Certainly good question, though. Thank you so much for calling, Bill. We appreciate that. And during the pandemic and the quarantine, how did you handle all of that? Did you notice, were you able to still, how did that affect your practice?
We were initially restricted some as far as elective surgeries because they were worried about the beds in the hospital using beds that may be needed for the COVID patients. So initially we did have to postpone a lot of elective surgery. Anything that was emergent or needed to be done right away, we would do that. Any bowel perforations, incarcerated hernias, or other problems, bad gallbladders that needed to come out, we were doing all those, but we were cut back some on elective surgery.
Okay. We have a Sharon on the line now. Sharon, thank you for calling. What's your question?
Hello, good afternoon to you guys. I just have a question. Back in 2005, with the birth of my last daughter, all of my births were, I had C-sections, and the last daughter, they did it, instead of doing a bikini cut, they did traditionally cut and opened up, and I gained a huge hernia. I have gotten what we call mesh inside, but it has reopened. And so I would like to know if I was to go and get another surgery done with the mesh already in, because they have looked over my stomach and said that the hernia has returned, but instead of it being a classical hernia, is kind of transforming this side by side. Would I still be able to get it done laparoscopically, or would they have to take out this mesh, or what would I have to do?
Yes, that's actually a great question, and we can certainly, any of us, me or Dr. Burke, we can certainly take a look at your case and more specifically answer your question. However, the fact that you've had a hernia before and you've had it repaired, you can certainly still do it laparoscopically or robotically, depending on where that mesh is and how much it has shifted. Will determine the need for whether it needs to be removed or not. After we get an imaging, a CT scan, to take a look at the hernia, look at the size of it, the location of it, where that mesh is now, and what's in that defect, whether there's bowel in it, and etc. So yes, the short answer is yes, you can certainly get that repaired robotically, and we'd be happy to help you with that.
Yeah, just have to come in so
so
we can evaluate you
look
and see what we could do.
What was your
Okay,
other
and I
question?
would just refer to the number that's on the on the screen, the 318-219-4569, or the another number
Or-
I would call to.
Or you can
reach out to
call
you
the
guys.
212-6070, and you can ask for either one of us, and we'll be happy to see you. A lot of times we both get together and we'll see the same patient if it's a little more complex, and discuss with you the options of what we could do with that. So a lot of times you get evaluated by both of us instead of just one of us when it's a little larger thing or something that's a little different.
Correct.
Okay, what insurance do you take?
Most insurances we take, the office manager deals with all that. We just try to see everybody that calls.
Yeah, if you contact the office, they'll be able to answer that question for you. And we see pretty much any insurance. So.
All right, great. Thank you so much. You guys have a wonderful
All
afternoon.
right, you're welcome.
You're welcome. Thank you for asking the question.
Yes, thank you so much for calling. And we'll have this information too posted on the KTBS.com Healthline 3 page. According to these doctors, you'll have all the information with them. And if you have any questions about that and can't find them, you can call us and we'll direct you right to them too. But they'll have their phone number and address. And while we're talking about that, where are you located?
We're in the main campus of the Willis Knighton Hospital, which is here at North on Greenwood, Greenwood Road. And we're in the Medical Arts Building, the 3rd floor, 310.
Okay, great. And so when someone, tell us what happens next. Someone comes to see you, they know this is going to happen, they know it is, then what happens?
So depending on what the patient has, and for any patients out there who are listening, if they have any, intra-abdominal illnesses or something that they have been told needs to be operated on, we're happy to see them as a consultation, and we're happy to take a look at what they might have, whether it's gallbladder disease, whether it's acid reflux disease, whether it's intestinal issues, whether it's hernias, any type of hernias. There's a variety of hernias, of course. We'll be happy to sit down, look over your history, look over your condition, and explain what role the robot can play and how it can help you specifically as a patient. And whether we need, sometimes we may have to get a CT scan or obtain certain images to further look at the issue before we recommend exactly what will need to be done surgically.
And then they just go for it, and there it is.
And we evaluate them and hopefully perform their surgery, and they do well.
And we're talking about it, and it just sounds so easy and so matter of fact, but it really has gotten that precise for you now. You walk in and it's really so easy for you to take good care of, even better care now of these patients with this kind of surgery.
Well, we both have a lot of experience in doing that, and as I said, you kind of get both of us when you come in, so you a lot of times have 2 people looking at it, and that gives us much more expertise and more experience.
It really does. It's another reason I'm so glad we have both of you on here today, because to have this combined interest and 2 people really working on you to help you and make it better is just really an amazing advantage to have.
And then if one of us is ever out of town, the other one's there. Somebody's always there to take care of you.
That's really a good point, that and you'll feel just as comfortable if something happens, or if you're called away into something, surgery, taking care of someone, and we have one of you, it's the same thing. It's very comforting. Very good. And the whole team, like you said, that's been trained to do this.
Yes.
All right. Anything else that you'd like us to know or that you'd like to leave the viewers with?
No, like I said, like I mentioned earlier, most of our patients are usually referred to us by their primary care physician or another provider. So we always want the patients to be informed, to be well informed, to know that robotic surgery is a tool that can be used for almost any procedure, any surgical procedure out there, and patients should certainly ask questions, should certainly inquire about robotic surgery and whether it's an option for them or not.
And I'm sure you encourage anyone to bring in your list of questions. Don't worry about your asking anything. Nothing is silly or out there. Just ask you anything that they want to know.
Correct. We tell people there is no stupid question. That anytime you have a question you want answered, it's a good question, and we're happy to answer any question you have. We're happy to go over the benefits of the robot and how they could help you in your surgical procedure if you needed one.
And just take the time. Don't worry about it. Just ask you everything and bring any of their concerns that they might have. And what is the recovery time just before, like, someone thinking about gallbladder surgery, or what is it typically the recovery after this?
So most patients that undergo gallbladder surgery, it's a day surgery, or even hernia procedures. The vast majority are 1-day procedure. You come in, you get the surgery done, you go home same day. Once the anesthesia wears off, you're up and about. You may need some pain meds for usually about 2-3 days. If you still have some soreness after that, the vast majority of the patients are back to their normal routine. With the exception of heavy lifting or extraneous exercise, which usually needs to wait about a week or so.
Okay. Well, thank you so much for being here. It's been such a pleasure talking to both of you today. I really appreciate your time because I know you are busy out there taking care of people, so I really appreciate it.
Thank you for having us.
Thank you for having us.
Oh,
good to
sure,
be here.
Appreciate it.
Oh, well, happy to see you next time. We'll come back.
Thank you.
All right, thank you.
Excellent.
And for everyone else, thank you for joining us for Healthline 3. Have a great afternoon. Take care, and we'll see you next time.